Hello, and welcome to the fourth edition of the Underground Conservative News Show. Today is Friday, October 30th, 2009. I'm Nancy Wright.
And I'm John Johnson. Tonight, we discuss the effects of the stimulus package.
And we answer a question we posed in our last installment.
Was it my question about if I would get to talk about the environment?
I'll answer that right now. We won't have time, it's only a 5-minute segment.
I could go on for a half hour about the global warming myth without repeating myself. This 5-minute thing stinks.
Anyway, the question we will be answering is what the other details are in the healthcare reform bill, and they are not pretty.
Not as pretty as you.
Thanks. I think. Did you just flirt with me?
I'm not sure, now that I think about it. Let's just get to it.
It is being reported that the stimulus package has created or saved 650,000 new jobs.
Wait, I heard they only reported 35,000 a few days ago, and that at least 5,000 of those jobs were counted at least twice.
Yes, I had heard that as well, but White House officials adjusted the number.
I would think that would mean they would come up with a smaller number. How did they go from 35,000 being too high to well over 500,000 in a couple of days?
I agree, it does sound strange. And this new number is being reported by the Associated Press.
Was it Calvin Woodward who reported that? I hope not. I was starting to like him.
No, it was Matt Apuzzo and Brett Blackledge this time.
Well, Matt and Brett, I hope you don't actually believe this nonsense. I have some questions, Nancy. What do people outside the White House say about says saved jobs?
Nothing much. How would you know if your job was saved by the stimulus package, or if you just maintained it through hard work? I think the hundreds of thousands who are still losing their jobs despite their dedication can attest the stimulus cost them their work. But the jobs that are claimed to be saved according to this article are teaching jobs, about 13,000 in Indiana, and it's big after that, only reporting how much money went to a few states, and for how many contracts.
Did those two just get out of journalism school? It seems they are just repeating what they hear. Does anyone separate the jobs saved from the jobs created? If 13,000 teachers were not laid off, it seems like the White House is more than happy to say those were all jobs created or saved. I would like to see how many jobs are created, not how many people are still working. Where would I get something like that?
I don't think that list is available, John.
Also, I remember seeing the list of where the money was supposed to go, and I never saw schools in there at all. Most was to go to acorn, dung beetle research, and the study of cattle flatulence, also known as a cow fart, but the administration didn't seem to care too much about giving money to schools, or, say, families of our soldiers in the Middle East, which is where I would direct funds, if I was in charge of a stimulus package.
Well, John, I understand each state government received a portion of the money to distribute as they saw fit.
Well, maybe we should contact our governors and try to get a concrete number of jobs that were started with the stimulus package. We should also compare that number to the number of lost jobs in that state and see how the package is really working. I bet the White House would disagree with those numbers. Hey, Matt Apuzzo and Brett Blackledge of the Associated Press, let's see you put some investigation like that into your reporting, huh?
It would be nice for a change. Now, onto the other parts of the healthcare bill. It seems like a large part of the rest of the bill focuses on getting coverage for people with pre-existing conditions.
Do we need government-regulated reform for that? Surely, this is nothing new to the health industry. This is what charity is for. Is there no community left where people give $1 or $2 by the cash registers of local businesses to cover expensive surgeries? Are there no doctors willing to do work for a discount? They could write off any loss from their tax as a charitable deduction. They should get much more work as a result as well. I see no need for government intervention. This is a problem the people can work out.
You do raise a good point. Next, there will be no ID needed to receive public treatment.
So someone with no ID, like an illegal immigrant, can get public care with no questions asked, and I have to pay for it?
It looks like that is true, John. Also, we will have to pay for abortions.
No surprise there, Obama loves abortion. But let's back this up a bit.
And there will be the infamous death panels.
Hold on a sec.
Hi?
Back this thing up. If there is a state opt-out in the public option, wouldn't that mean states who opt in would be overrun with illegals who want to be close to free health care?
That's a lot to think about, and our time is up. For the Underground Conservative News Show, I'm Nancy Wright.
And I'm John Johnson, saying the truth is more valuable than gold, and easier to find.